And welcome back. Anyone who's had a migraine knows how debilitating they can be, and for some, this problem becomes chronic, affecting all aspects of their lives. In honor of Migraine Awareness Month, we're joined now by Good Housekeeping Editor Laurie Jennings, along with headache specialist and neurologist Dr. Jessica Ailani. Good morning, ladies.
Good morning.
Good morning.
So let's talk first about the difference between a headache and a migraine. Dr. Ailani, what is the difference and how can people tell which one they're actually experiencing?
So a headache usually is milder, nothing that's going to make you stop everything you're doing and sit down just so you can get by. Migraine is usually a moderate to severe headache that comes with stomach upset, a little bit of light or sound sensitivity, and sometimes can get very severe and makes you want to just lay down in bed. Chronic migraine is when you're getting headaches more than half the month, and at least 8 of those are like I just described, the kind where you want to just lay down, the lights and sounds are bothersome, and your stomach is getting really upset.
Let's talk, Laurie, about this partnership. Why is it important for Good Housekeeping to really invest in this topic?
Well, Good Housekeeping was partnered with Allergan on this subject because here we are, we're in Headache and Migraine Awareness Month, and there are so many people who are suffering in silence. I mean, women are 3 times more likely than men to suffer from this condition, and only 20% of people have been accurately diagnosed. So there is a lot of misinformation out there, and we would like to empower people with information, help them learn that there are treatment options, that they can do something, they can seek out a headache specialist, and really get the care that they deserve.
Migraine Awareness Month. Migraine Awareness Month covers more than just getting the information out there. What other events are going on that are in support of this month?
So probably our biggest event just completed, it was the American Headache Society's annual scientific meeting. At the end of that meeting, there was a patient meeting for the entire day where they were able to get a lot of the similar information the healthcare providers were given about treatment options in migraine, treatment options for other headache disorders, and what's new and what's coming. And from this meeting, you get a lot of press activity where people who aren't unable to attend or unable to get there are going to be able to get more information about what's coming and what's in the pipeline and what is migraine, because it's a very common question we see in clinic.
And that's got to be very encouraging for those who have been dealing with this issue already. But let's talk a little bit about headache specialists, because I think this is maybe one of those fields of medicine that only recently are we becoming very familiar with. What is the difference between a headache specialist and, say, a neurologist?
So a headache specialist is somebody who has taken a greater interest in the field of headache and has either applied and taken and gotten credentialed in the field of headache, or they've sat for an extra year and gotten education on headache medicine. And the focus of their clinic is going to be headache 24/7 versus all the different fields in neurology. So it makes us a little bit unique. You definitely probably haven't heard about us, but we've been around for quite a long time.
When it comes to treatment, let's talk a little bit about the difference between preventative and acute treatment. What are the differences there?
So preventive treatments, that's something that you're using to reduce the frequency and severity of headaches. So looking at chronic migraine, currently the only FDA-approved treatment for chronic migraine is Botox, and that's a treatment that's given by your healthcare provider every 12 weeks to reduce the frequency and severity of your headaches. When you're actually having a headache, especially a migraine, it's really important to treat immediately to try to make yourself feel better and stop that cycle that's occurring. That's when you would use something called an acute treatment or an abortive treatment, something that you take or you inject into yourself to try to stop the headache from continuing.
And for those dealing with chronic migraine, quickly, it's not just about the person who's struggling with it, but the family as well. What advice do you have for those caregivers in people's lives who do deal with chronic migraine?
Well, you absolutely want to educate yourself and be supportive to the person who's suffering. So people sometimes feel like they can't speak about their symptoms or talk about them because their friends or family might dismiss them. So more than anything, you want to educate yourself and be supportive. A great resource to help you is BotoxChronicMigraine.com. Tons of information on that website, as well as a place where you can put your zip code in to get a healthcare provider near you.
All right, ladies, thank you so much. Great information today. We appreciate your time.
Thank you for having us.
Thank you.